The current recommendation is that everyone over the age of 6 months should get the flu vaccine. And this year, it's doubly important that you get the flu vaccine because if people have fever and respiratory symptoms in the fall, the first concern is going to be coronavirus, and it's really the symptoms of the two diseases are very hard to tell apart. So if you get the flu vaccine, you're less likely to get the flu and therefore less likely to be thought of as a possible coronavirus case. Vaccines have been hailed as the biggest public health achievement of the 20th century. We have been so fortunate to live in an age where so many diseases that were very, very common have been almost eliminated. So in the United States, for instance, we don't see polio, we don't see tetanus, we don't see diphtheria cases, and many, many other diseases have been reduced to very, very low levels, so things like measles and mumps. And this is all due to vaccines, because these diseases are very preventable through vaccination. It's estimated that in the world there are about 285 vaccines prevent about 285 deaths an hour, so very powerful public health tool. And in the United States, many of us have actually never seen several diseases that were very prevalent during our parents' time. So vaccines are very effective, they have a very good safety record, and they do a lot of good. Typically, it takes 6 to 8 years to bring a vaccine to market. So the first step in developing a vaccine is to actually do what are called phase 1 trials, where the vaccine is tested in laboratory settings to make sure that the vaccine works against the disease that it's intended to prevent. And there are also sometimes animal studies performed to try and decide what the optimal dose of the vaccine is. The next step is called phase 2, and this is where vaccine is tested on a small group of volunteers, usually 10 to 20 people, again to see what the most appropriate dose is after the vaccine has been shown to be safe for humans. The third step is called phase 3, and here we test many, many more people and look at how effective the vaccine is at preventing the disease in real life situations, and also look at how safe it is. And then there's multiple reviews of the vaccine by regulatory agencies. In the United States, it's the FDA. And then the vaccine is licensed and it's allowed to be sold and used in individuals. And the whole vaccine testing process doesn't actually end there. Even after the vaccine is used in people, there are what is called post-marketing surveillance. So government agencies and private agencies are looking to see if there are any new safety signals when it's used in thousands of people. So the vaccines are really very rigorously vetted, and I would say are much, much safer than many drugs on the market. As a parent, it's understandable that you always want to do what's best for your child. And so vaccines, I think, are the best thing you can do to protect your child from illness. If you have questions, there are so many sources of credible information out there. The American Academy of Pediatrics is one, the CDC is another, but nothing beats talking to your child's a physician, a nurse practitioner, asking them questions about vaccine safety. They're generally very well informed and will guide you to help you make decisions. There are lots of unreliable information out on the public media too, and so it's very easy to get lost in social media posts that highlight misinformation about vaccines. So again, if you have any questions, talk to your own provider. That's probably the most reliable source of information.